Complementary or alternative veterinary medicine refers to therapies that are not part of a traditional veterinary education or practice. This includes things like acupuncture, homeopathy, herbal medicine, and yes, animal chiropractic. Demand for veterinary care continues to grow in general, and along with that, a demand in these alternative therapies. For example, one client survey study in Sporting Dogs published in 2021 revealed that 73% of owners used chiropractic and 12% used acupuncture as part of their dog's maintenance care. Questions about these alternative treatment methods are something I get asked a lot of in my practice and online. So in this video, I'm going to review some of the more common alternative therapies. We'll be discussing acupuncture, chiropractic, CBD, homeopathy, and a few others. At the end of each methodology, I'll give them a corresponding grade of A through F based on the amount and quality of evidence behind each one and the risk benefit of using each methodology. This is all to help you, the pet owner, make an informed decision when speaking to your vet about treatment options. But before I do that, guys, please perform a manual adjustment to the meridian corresponding to the diluted like and subscribe buttons. And now let's begin. All right, so the first therapy I want to go over today is acupuncture. Acupuncture is an approximately 3,000-year-old medical practice that originated in China. Acupuncture utilizes the insertion of small, sterile needles into specific points in the body that are called acupoints. Acupoints, when stimulated by a needle, stimulate a response from the peripheral, central, and autonomic nervous systems. There's also modifications to the needles themselves that you can make, such as varying pressure application, injection of sterile liquids along with the needle, or even adding an electrical charge. When an acupoint is stimulated by insertion of a needle, a number of neurochemicals such as serotonin, glutamate, and cannabinoids are released. The release of these and other hormones is thought to interact with the peripheral and central nervous system to help regulate pain and inflammation while improving circulation in the local soft tissues. Indications for acupuncture in veterinary patients are pretty broad and include various causes of pain, neurologic dysfunction, autoimmune disease, gastrointestinal disorders, and many other things. Now, one thing to consider in performing acupuncture is the fact that animals need to stay still in order to receive the needle insertions. You probably know this, but not every dog or cat will do that, and there is a possibility of pretty significant anxiety, fear, or even aggression during a treatment. Flailing around during attempted needle insertion can obviously lead to injury both for the animal and for the practitioner. Other things to consider are avoiding contact with a major nerve, blood vessel, or something like a large tumor. But overall, the risk of acupuncture seems to be pretty limited in the short term. Now let's examine the evidence for acupuncture. Now, as far as research-backed evidence supporting the efficacy of acupuncture, it's kind of lacking. A scoping review published in 2017 looked at 179 experimental studies on various species and found that due to, quote, a limited number of controlled trials and the breadth of indications for use, outcome categories, and types of acupuncture evaluated, these present challenges for future systemic reviews or meta-analyses. The authors concluded there is a need for high-quality randomized controlled trials addressing the most common clinical uses of acupuncture and using consistent and clinically relevant outcomes to inform conclusions regarding the efficacy of acupuncture in companion animals. A systematic review published in JVIM in 2006 set out to assess the clinical efficacy of acupuncture in veterinary medicine. While some studies were noted to be encouraging, such as those looking at various forms of pain, diarrhea, and possibly spinal cord injury, these trials were noted to be in need of independent replication. Overall, the authors concluded that they can neither recommend nor reject acupuncture for any condition in animals. You have to keep in mind when looking at research on the efficacy of acupuncture or any treatment modality that you're trying to assess, you have to compare it to a control group of some kind that doesn't get the treatment, i.e. acupuncture in this case. And a lot of studies just don't use that research methodology. So you don't know oftentimes if the results you're seeing are due to acupuncture or just an animal healing through other means or even on their own. So overall, I would give acupuncture a B grade, maybe a B- grade, because evidence-wise, I feel as though the jury's kind of still out. But most importantly, there really doesn't seem to be much immediate risk in doing it so long as the pet tolerates the procedure. I think it's fine to use acupuncture alongside traditional treatments and whatnot, but I'm not sure I would ever recommend it as a standalone therapy because the evidence isn't 100% clear. Now, in full disclosure, in my own practice, I offer it up all the time for pets who are having chronic pain and they need some sort of multimodal pain management. I have clients ask me all the time about acupuncture, and I usually say something like, there really isn't much immediate risk. So because of that, I say try it if you want to, see how your pet does with it, and go from there. Now, I do want to mention, though, that the International Vet Acupuncture website lists some conditions where acupuncture is indicated, and I gotta voice some concern here. I very strongly would not recommend acupuncture as a sole therapeutic agent for many of the conditions listed right here. If your pet suffers from one of these conditions, please have a full and complete discussion with your vet regarding options, including consultation with a specialist like me, as indicated. For example, if your pet becomes suddenly paralyzed, which is very likely from a herniated disc, do not make an acupuncture appointment. See your primary vet or emergency vet ASAP. Chiropractic was founded by D.D. Palmer in the late 19th century, but was likely in practice in some way, shape, or form before then in other cultures. D.D. Palmer believed that the human body has a constant supply of healing power brought to it via the nervous system. He proposed that if an organ or body system is diseased in some way, it must not be receiving its normal nerve supply, and this in and of itself indicates a spinal misalignment, or also known as a subluxation. This is why chiropractors seek to realign the spine. When we talk about chiropractic in animals, we're really mainly talking about manual therapy or spinal adjustments. According to the AVCA, a chiropractic adjustment is delivered by a high velocity, short lever thrust delivered by hand or instrument to specific articulations, joints, to correct these vertebral subluxations. Indications for chiropractic are, as you might guess, pretty broad in scope. Pretty much any symptom that you can think of, a chiropractor can justify performing an adjustment for. I believe this is because the inherent philosophy of chiropractic is that any disease or organ malfunction is in need of spinal realignment. It's a central tenet of the practice, but it should be noted that these spinal subluxations have never actually been confirmed to actually occur in any study. It should also be noted that when they say subluxations, they don't mean a fully dislocated joint in the traditional medical sense like we talked about. This is the AVCA's listed indications, and you can see for yourself how broad in scope this is. Again, I believe this is intentional because it allows a chiropractor to justify pretty much any problem being in need of an adjustment. I would also argue that the vast majority of indications for chiropractic care are actually contraindications. Let's take a very common problem that I see almost every day. That's an intervertebral disc herniation as an example. The vast majority of herniated discs in dogs occur because of dogs' genetics, especially specific mutations such as chondrodystrophy or CDDY. This mutation is nearly ubiquitous in certain breeds like French Bulldogs and Dachshunds, ones that we see all the time with herniated discs. This genetic alteration causes their intervertebral disc, that's the cushion sitting in between their vertebrae, to start degenerating severely and quickly soon after they are born. This is why when or if you do an MRI on a 1-year-old French Bulldog, their discs are oftentimes completely dark and dehydrated already this early in life. This is due to their genetics, not some sort of spinal misalignment or subluxation, which is what an animal chiropractor will tell you. And if they tell you that, they are wrong. And when these dogs herniate a disc, their disc literally ruptures or tears open underneath their spinal cord, and the core of the disc, the nucleus, shoots out to both bruise and severely compress the spinal cord. This is why these dogs suffer pelvic limb paralysis and severe back pain. They're suffering severe spinal cord injury. Now, to give you an example, this is an MRI on a patient that I recently performed surgery on for this disease. This is a cross-sectional image of a normal part of this dog's spinal cord. And you can see the gray oval sitting there nice and pretty. That's the spinal cord looking very nice and normal and non-compressed, not injured. This is normal spinal cord. This is a few spaces in front. The spinal cord is getting smushed all the way to the left, and that huge black bubble is all herniated disc sitting underneath it. You can get a sense of how compressed and how injured the spinal cords are in these poor dogs. Now, a couple of things should be crystal clear here. The first is that trying to manually adjust their spine with a high velocity thrust creates nothing but pain and risk of more disc herniating out and worsening the spinal cord injury. At best, this would create maybe mild pain with no benefit. But you do not have to search very far to find animal chiropractors on social media performing adjustments in paralyzed dogs who are clearly in pain during this adjustment. Now, as a vet who formerly specializes in neurology and who performs neurosurgery every week on dogs and cats, please, if your dog is paralyzed, do not pursue chiropractic adjustments for them, no matter what you hear online or in person. I had to say this part. So let's talk about the evidence for chiropractic in animals. Now, as far as animals go, horses seem to have the most research evaluating the effects of chiropractic adjustments. A recent systematic review of 13 research articles show what the authors describe as a wide array of outcome parameters with varying levels of efficacy and duration of therapeutic effects, which prevent further meta-analyses. Therefore, it is difficult to draw firm conclusions despite all the studies reporting positive effects. But in my opinion, if you dig into some of these studies a little bit, that positive effect seems questionable at best oftentimes. For instance, the authors mention how one study showed positive clinical effects seen 1 hour after a chiropractic treatment, but those effects were gone on recheck in 3 weeks. Another study showed an effect from a spinal adjustment, but this was in horses who didn't even have back pain to begin with. And when a study looked at horses who actually had acute back pain, a chiropractic adjustment produced no significant effects on its own compared to low-level laser therapy or combining chiropractic and laser therapy together, i.e. the lasers doing the work here. Now bear in mind, a horse's vertebra is really big, about the size of a human hand, and it's covered in multiple inches of soft tissue, muscle, fat, connective tissue, etc. So it does beg the question, even if the tenets of chiropractic were true, is a human hand even able to adjust something that big at all? Now in dogs, there is basically close to zero evidence whatsoever supporting the efficacy of chiropractic adjustments. One study I found looked at boxers receiving adjustments for the first year of life and found a reduced incidence of what's called spondylosis. That's bone formation along the bottom, or what we call ventral aspect of the vertebral bodies. This is an incidental finding in the vast majority of cases and causes no observable pain or other symptoms unless it's very advanced, and even then, it's oftentimes seen incidentally on x-rays. This paper, whose author is an animal chiropractor and who probably wants results that support their practice, also has some really weird statements, like when the author claims to, quote, see a lot of very short L7 vertebrae, and how hypermobility might be painful, or how the body will try to stabilize a hypermobile joint and spondylosis might occur. I mean, I'm not some world authority on research paper editing, but how in the world did completely subjective, unverifiable language like this make its way into a published study? This is like me publishing a paper and saying, I feel as though that should happen. Like, that doesn't make sense at all. And I do not think this is a language barrier either, because there's plenty of studies published outside the US that don't contain wordage like this. Now, if you want a complete breakdown on why this article really is not convincing in the slightest, even though it's quoted by animal chiropractors all the time, check out the Skeptic Vet's blog post on this matter. He did a great job detailing the shortcomings of the study. I'll link it in the description. So yeah, that's the entirety of the literature supporting chiropractic in dogs. I couldn't find anything in cats. Overall, I would give chiropractic a D for horses and a big old fat F for dogs and cats. The latter for the simple fact that there isn't any evidence even remotely supporting its use, and there is real short and long-term risk associated with these adjustments. I would give it an F for horses, but I think horses are actually too big to physically harm with your own hands during an adjustment, but I could be wrong. As a neurologist, the most common alternative therapy I get asked about is CBD, so I definitely had to mention this one. Real quick, cannabidiol, or CBD, is found in cannabis alongside its psychoactive counterpart, THC. CBD has a few potential benefits to treat conditions like arthritis, epilepsy, inflammation, depression, and others. CBD receptors are found in many organs and tissues in dogs, and the hope is that CBD could allow for alleviation of a lot of different things like, say, chronic pain. A systematic review published in 2023 looked at CBD efficacy for the treatment of osteoarthritis in dogs. The review found 5 total articles to summarize, which isn't a lot, and the articles had a pretty high risk of bias according to the authors. Also, the CBD products themselves varied substantially. Overall, though, there were pretty few side effects listed, and it seems to be pretty safe in dogs. They also mentioned how most of the studies included patients receiving multimodal therapy like anti-inflammatory medications, physical therapy, etc., alongside the CBD. This makes it really difficult to draw out a clear effect from the CBD itself. Also, one of the studies was literally funded by a CBD company, so come on. Now, I've done a video on CBD before a couple years ago, back in the prehistoric times of my channel, pre-Harrison. That's my editor. Shout out to Harrison. But more recently, a paper was published in 2023 out of Colorado State University because, of course, the vet school in Colorado would be doing this research, looking at the effect of CBD on dogs with epilepsy. The study was well designed, it's double-blinded, placebo-controlled, and it showed a 24% reduction in seizures in the epileptic dogs treated with CBD at a dose of 9 mg per kg. CBD was also very well tolerated with few adverse events, though there was some concern that it may raise liver enzymes a bit, which warrants lab work monitoring. overall, I would give CBD a grade of C, B, and a big fat D. No, I'm just kidding. I would actually give CBD a B, probably a B plus, because there's some actual good evidence and research going on here that seems to show some promise. And most importantly, CBD seems to be very well tolerated and doesn't carry much risk at all when given to dogs. All right, let's talk about turmeric for a second. So I've heard of people using turmeric here and there, and people ask me that sometimes in my practice. And as it turns out, there is a study that has looked at turmeric in dogs. The study was randomized, double-blinded, and placebo-controlled, and it looked at dogs with arthritis receiving either a diet supplemented with curcuminoids. Curcumin is the major compound of turmeric. I hope I'm pronouncing that right. Objective measures like ground forces, i.e. how much weight they're putting on a limb, and biomarkers did not change, while subjective measures such as perception of pain responses during an exam did. Another study in 2021 compared the use of a base nutraceutical, i.e. glucosamine, chondroitin, fish oil, stuff like that, with and without a curcumin additive. Curcumin is the active ingredient in turmeric. The group supplemented with curcumin demonstrated an increase in ground reaction forces, whereas the group on the base nutraceutical did not. A study in 2003 looking at curcumin products failed to show a positive effect on lameness in dogs suffering from arthritis. These turmeric compounds seem pretty well tolerated. I didn't see much evidence that there was a lot of adverse events or anything like that in these 3 studies. Maybe there's some effect, maybe there isn't. I'm not sure, but overall, I'd give turmeric a C because I have no idea if they work or not based on the available data. But there's also not much immediate risk I can tell either, at least directly giving the compound. Moving on to homeopathy. Why am I talking like a baseball announcer? It's homeopathy time. Homeopathy came about in the late 18th century by the German physician Samuel Hahnemann. I think I'm pronouncing that right. Homeopathy proposes that you can treat a disease by administering extreme dilutions of substances that, in an undiluted form, might cause symptoms of that disease, and this somehow promotes healing. The idea is that these substances gain a healing energy when diluted to an extreme degree. Now, it should be noted that there is no known mechanism of action by which this supposedly occurs. As far as indications go for homeopathy, homeopaths generally feel that their treatments are indicated for most medical conditions, but there really is no research that supports this claim. Any animal that is suffering from an obvious, say, infection, pain, or other systemic illness really should have that condition treated promptly with regular traditional medical treatment. A systematic review of 15 publications that looked at homeopathic treatment of many conditions found that most of the studies suffered from various forms of bias, and only 7 were randomized controlled trials. Most studies found no positive effect on the various outcomes measured across multiple species. One study that looked at horses with laminitis found an improvement after 1 day, but the study consisted of only 5 horses, was not randomized or controlled in any way, and was at a very high risk of bias. I'm going to give homeopathy a D because homeopathic principles make absolutely zero sense to me whatsoever. They're not proven at all. They're not based on anything scientific or even real as far as I can tell. And I think there's just a high risk of short and long-term harm to animals by using this type of treatment over traditional medical treatments. But I won't give it an F like chiropractic because I don't think a homeopathic remedy can cause an immediate side effect and immediate pain like a manual adjustment could. All right, guys, that's all of the alternative therapies for now. Let me know in the comments below what you think, if you agree or disagree with some of my grading here. Love to hear what you guys have to say. Don't forget to hit the like and subscribe button, and I will see you on the next video. Take it easy.